A very good morning to everyone. This is Batul, the moderator for today's session from IJCP, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Well, sir, needs no introduction, but yet it's our great pleasure and honor to introduce him. He is none other than the very renowned neurologist, Dr. Purvak Puranik, sir. Sir is MD, DM in Neurology, Director at Puranik Academy of Medical Education, Emeritus Professor of Medicine, Neurology, Department at MGM Medical College and MYH Hospital, Indore. With Sir's wonderful insights, we are going to talk about the topic for today, which is clinical insights into speech and language disorders. So now, without any further delay, we would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. So over to you.
Good morning, everybody. My thanks to MedTalks webinar for giving me this opportunity. I'm aware of this platform right from the days of Dr. K.K. Agrawal when I used to listen to him on his many presentations. I would be speaking on clinical insights into speech and language disorder. Speech and language disorders are many, but I would be mainly focusing on symptoms and signs of aphasia. So how to make it forward? So scope of aphasia is very wide. It can be mild to severe. It can be motor. It can be sensory. By motor and sensory, we mean that a person with a speech disorder may have more problem in expressing the efferent part. And by sensory, we mean more problem with afferent or comprehension. The language disorders can pertain to verbal domain, can pertain to written domain, can pertain to sign language or any combination. Articulation, the pronunciation, when it is affected is called dysarthria, which may or may not be present. Similarly, when we talk about speech and language problems and aphasia, we also pay attention to linguistic aspects, whether phonology is affected, sound pattern, semantics, the meaning of the words, syntax, the grammar, discourse, the conversation, and then most of the patients with language disorders and speech and communication disorders will also have associated deficits in higher mental function. So, as a clinician, we should not lose sight of that. The variability of a performance of a person with aphasia can be dependent on many factors like fatigue and the mood of the person. So, I will not go into that detail. Symptoms are the ones which are complained by patients and caregivers, and signs are the ones which are noted by the clinicians during the physical examination. At the end of the examination, a clinician should be in a position to comment on the overall severity of aphasia, and it ranges from most severe, which is the grade 1, where there is no usable speech or auditory comprehension, to grade 6, where there is a minimal discernible speech handicap, and in between you have 2 to 5. The list of possible symptoms which can occur in a person with speech and language disorder or aphasia could be many. There may be total loss of speech, that is mutism. There can be reduced speed of talking or speaking fewer words, or word finding difficulty, or using a wrong word which is called as paraphasia, or sometimes using a language which is totally unintelligible, which is called jargon. There are many symptoms in a person with aphasia. Sometimes they use a word which does not exist in the dictionary of the language known to that person. We call them non-word or neologisms. In some patients with severe non-fluent aphasia, the speech output may be restricted to repetitive, meaningless, irrelevant monosyllables, which are known as CV, recurring utterances. A few patients, when they are finding difficulty in getting a word, they go with a roundabout description around a target word, and then we call it circumlocution. So there are many more symptoms. I will not go into the detail. I think I will come mainly to the how to examine a person with aphasia, and it has 4 or 5 main headings. Number one is auditory comprehension, by which we mean that if we are talking to a person with aphasia, whether he or she is understanding, comprehending the speech or not, and this is affected in many patients. Articulation, as I told you, is pronunciation. Then fluency in verbal expression is a very important part of aphasia. And then repetition, naming, reading, and writing. So I will be covering these things in somewhat detail, one by one. In case of auditory comprehension, we ask the person to point to the objects and pictures. I will show some of the examples. For example, if we have a picture card, there are many pictures. So we will ask, where is the picture of horse? Where is the picture of cow? Where is the picture of car? Something like that. And the person is supposed to point to it. This is a test of auditory comprehension at one word level. Another step in the testing of auditory comprehension is we will give him some simple commands and see whether he or she is able to follow that command or not. And finally, we can tell them a short story or a paragraph, and then we can ask questions based upon that. So I will show you some examples about them. We have developed a test of screening, a short test which can be administered in 10 minutes at Indore, and we call it HACIT. And we use some of these tools in that. Then we come to oral expression or verbal expression. And here we ask the patient to speak more and more, or ask him to narrate his job. For example, we can show them these pictures and we can ask him, hey, describe what's happening in this picture, or describe what's happening in this picture. So this is the way we can force a person to speak a few sentences, or this picture, or as the story of a girl with umbrella, or the story of a lady with a purse and a thief is trying to snatch the picture, and a good Samaritan comes to rescue the lady's purse. So these type of cartoons and picture stories can be shown to the patients, and but the purpose of all these pictures is to force the patient to narrate. And once we have got a good sample, we can do many calculations, we can do many inferences. How is the speech, what is the fluency, is it fluent or non-fluent, what is the word finding difficulty, and so many other things. Is the picture description thorough and complete, or is it sketchy and incomplete? So these picture descriptions are very, very important in assessment of speech and language. I was talking about auditory comprehension a minute back, and these are the type of pictures. So if I am testing auditory comprehension at one word level, I will ask him, where is the house? Where is the watch? Where is the bicycle? And I expect him to point to the picture if his auditory comprehension is normal. Or we can use verb pictures. Where is someone running? Where is someone eating, or sleeping, or falling, or writing, or cutting? So these are the action verbs for which we can test auditory comprehension. As I was talking about oral expression and about the picture description, based on the picture description, we will pay attention to, is there circumlocution, are there paraphasias, are there perseverations and neologisms. So many things can be detected in the case of oral expression. We also pay attention, how is the articulation, how is the output, is it reduced and non-fluent, or is it normal or increased output. We pay attention to articulation, and we can describe the dysarthria under many subheadings. Dysarthria can occur in Parkinsonism, in pseudobulbar palsy, in cerebellar ataxia, in cranial nerve palsies, all these conditions in which the muscles concerned with the articulation, they are weak. There can be problems with dysarthria. A word about non-fluency. A large number of patients, particularly those who are suffering from Broca's aphasia, which is a very famous type of aphasia, they have non-fluency. They speak reduced number of words per minute, reduced number of words per sentence. They have a lot of pauses or hesitancy, and that phenomena is called agrammatism. They omit the function words and they use only the content words. What are function words? What are content words? Function words are auxiliaries and prepositions and conjunctions, all those grammatical words. And what are the content words? The noun, the adjective, and the verbs. So in patients with Broca's aphasia, non-fluent aphasia, who are having agrammatism, they will mainly use the content word. And when we make a sentence, they will not be using the grammatical word. There is other end of fluency which is seen in Wernicke aphasia. One was Broca aphasia, non-fluent. Then other end we have Wernicke aphasia in which they have high fluency. It is a fluent aphasia. And if you listen to them from a slight distance, it would appear as if they are having normal melody, normal rhythm, normal pitch. They will have long sentences but empty speech, poor content, lots of useless function words, lack of sense of completion. They will have jargon speech. So you can imagine how wide is the spectrum of oral expression in people with aphasia. I have already told you the auditory comprehension at one word level, at sentence level in the form of command comprehension, and at discourse level on the basis of questions asked for that. These are other pictures which can be used for auditory comprehension. They are not Indian origin, but they are very famous Boston Diagnostic Aphasia examination. So we can use grammatical shapes, we can use colors, we can use verbs, we can use numbers and letters. Another way of testing the auditory comprehension is giving command comprehension. We ask, say namaste, make a fist, close your eyes, first look at the ceiling and then look at the joint. The second heading in the testing of third heading is repetition. Here we look for ability to repeat verbatim whatever is spoken by the examiner. The examiner should carry with him a list of words and phrases which can be simple to begin with, and then gradually we go to difficult ones. If a person is having poor comprehension but good repetition, it is a type of transcortical aphasia. On the opposite side, if the person is having good comprehension but poor repetition, then it is likely to be the conduction aphasia. The fourth heading in the assessment of aphasia is naming. The same pictures which we use for auditory comprehension can be used for naming. In the test of auditory comprehension, what did we do? We told the name of the picture and asked the patient to put the finger. Now here there is a reversal of role. The examiner or the doctor or a speech language therapist will put the finger on the picture and ask the patient, what is this, what is this, what is this. We can put our finger on a picture or an object or a color or figure or body part. And what do we look for? We look for delay, we look for failure, we look for errors, then we give them cue. Cue means help or hint. We can give them hint in the form of first sound. So if the answer was horse and the patient is not able to say horse, we will say ha, ha, har, something like that. That becomes a cue. Or we will give him the wrong answer and say whether he is able to reject the wrong answer, and finally we will give him correct answer and we will see whether he is able to accept the correct answer or not. All these things in the assessment of aphasia are equally helpful in the later on therapy also, because the therapy is guided by the deficits in the assessment. And then the number fifth heading in the assessment of speech and language disorder is reading. So reading is ability to recognize and match and discriminate the alphabet words. Reading involves reading aloud words and sentences. So as a aphasiologist or as a speech language pathologist, we carry picture cards, or we nowadays in the era of smartphones, we can carry all those picture cards on our smartphone, and we can ask the person to read the printed words, the printed sentences, printed paragraphs. We can also give the commands which were given initially by auditory method. Now those commands can be given in the printed method and see whether patient can read and obey those commands. We give sentences for reading in which there are blank spaces, and then for the blank space there are 3 or 4 correct options, or one of them is correct and the patient has to pick up the correct option to fill in the blank. So there are many tests in the reading. Similarly, this is an example of sentence comprehension. So the dog barks, reads, sings. So the patient has to pick up the correct answer out of these multiple choice options. Finally, the sixth heading in the assessment of speech and language is writing. So we look for the quality of writing, the handwriting. Then we ask the person to do the copying. So there is a printed text and patient is supposed to copy. Then we say Listen carefully. Whatever I speak, you have to write. That is dictation. And we can show them many pictures and ask them, you are seeing all these pictures here, write down all the names of those pictures. And then the picture description. The pictures which we showed in the beginning, we can ask the patient, look at this picture, whatever is going on in this picture, start writing a paragraph on about the scene. So this is how we test the writing. This is one of the video. I don't know whether it will be audible.
है ना, जितना बने उतना अपने को बताना है। आप इसका नाम बता सकती हो, ये क्या है?
बल्ला बल्ला।
अच्छा, और ये क्या है?
बल्ला।
नहीं आ रहा आपको बोलते?
नहीं, बल्ला।
अच्छा, और ये क्या है?
बल्ला।
So she is having just one answer, Valla.
Same and same response is coming. I am continuing with the same testing. अच्छा, ये बताओ,
ये
क्या है? मालूम है तुमको?
हाँ।
इससे क्या करते हैं?
ये
हाँ, ये बच्चे उड़ाते हैं आकाश में।
हाँ।
देखा है तुमने उड़ाते हुए?
हाँ।
इसको क्या कहते हैं? बोलो, प
पा
पत
पा
तंग
पा
पतंग
पतंग।
पतंग।
हाँ।
पता है ना पतंग? The naming is also continued with respect to color naming, with respect to the verbs.
This is another patient.
अच्छा, कैसे हो आप?
She is global aphasia, and
कैसे हो?
whatever she speaks is totally ununderstandable. We call it jargon.
हाँ, ठीक है। पहले आए हो? पहले आए हो?
She can understand some commands, some questions. She can't describe the picture. This is another patient,
पानी पानी पानी
again having severe aphasia.
पानी दानी 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 पानी गाड़ी नहीं ड्राइविंग करते।
Right.
This was following head injury 18 months back. He is having Wernicke's aphasia, irrelevant speech, neologisms.
वाक्यों में बोलने का प्रयास कर।
नीचे तो अधिकांश लोग रहते हैं।
नहीं, इस तस्वीर में क्या दिख रहा है?
उसमें एक मंदिर है।
हाँ, बहुत अच्छे। और
He is not able to describe well.
और क्या दिख रहा है?
ये भी एक बाजार है, इसमें सभी बने हुए हैं। वो
बाजार है, बने हुए हैं. A sentence which doesn't convey any meaning.
एक हॉल जो है, हॉल से उसमें पानी
So he is using neologisms.
वगैरह है।
क्या है? अच्छा, और क्या दिख रहा है? इधर क्या दिख रहा है? इधर इस साइड
ये इधर तो
So I think I will skip some of the videos for the sake of time. This is anomic aphasia.
मंदिर
पूरा बोलो। मंदिर।
This is anomia. So otherwise he can talk, but there is a word finding difficulty with paraphasias and perseveration. Perseveration means repeating the same answer again and again, and paraphasia means substituting the answer with another word.
और
Assessment of aphasia is very time consuming, very laborious. It requires lot of patience on the part of the doctor and on the part of the patient also and caregivers also.
नहीं आ रहा है? But but
The answer should have been Bakri,
but
and the examiner is telling Buck.
और यहाँ क्या हो रहा है?
या आसपास देते हैं.
हाँ, बैठ के क्या कर रहे हैं?
So I think these are some of the pictures. I can show you a few more videos.
ठीक है, अभी मैं कुछ शब्द बोलूंगा, आपको रिपीट करना है. ठीक है.
This is the test of repetition.
बिस्तर,
नाक,
नाक,
हाथ,
हाथ,
खिड़की,
खिड़की,
केला,
केला,
इंद्रधनुष,
धनुष, इंद्रधनुष,
45,
45,
95%, 95%.
आराम से सुनो, आपने किया ही है अच्छे से.
अच्छा क्या है?
So gradually we make the target difficult.
शाम में 25,
55.5 किलोमीटर.
55 किलोमीटर.
ठीक है. वह वापस नहीं आ रहा है.
We ask them to repeat sentences.
वह वापस नहीं आ रहा है.
वापस आ रहा है.
पूरा रिपीट करना है.
भारत की पहली सेना.
भारत की पहली सेना.
Okay, I will show you one more. That fellow was able to repeat fairly well. Now this lady is having conduction
मैं कुछ
aphasia
शब्द बोलूंगी,
and her
वो
repetition is
आपको
poor.
दोहराने हैं. ठीक है, बोलो. बिस्तर.
कोई बात नहीं.
जो नहीं, जो सुनाई दे रहा है वो दोहराना है. नाक, नाक, हाथ, हाथ, खिड़की, खिड़की, केला, केला, इंद्रधनुष, इंद्रधनुष,
ठीक है, ठीक.
45, 95%,
Okay, this is picture description in the case of Broca's aphasia.
yes, yes, stop.
Plate and towel and
Agrammatic speech. Only the content words. Plate,
Clean.
towel, clean, wash basin, but no verbs, no conjunctions,
And,
no articles. It's a classical example
wash
of
basin
Broca's
and
aphasia.
water is
More problem with verbs. Water is over, but he's finding difficult. Water is overflowing.
okay, and girl is it is clean. Okay.
Yes.
Table and
Instead of stool, he's saying table.
boy is cupboard.
Yes.
Cupboard and
So we use these picture descriptions as a part of therapy also. So So all these are examples of different type of aphasia. I think I will conclude without any slides. For more content, you please go to this website. Please note it down. neurogyan.com/aphasia. So many of these examples would be available in Hindi and some in English also. Here I would devote the last 5 minutes without any slides. What I want to say is that disorders of speech and language are a major disability for people with aphasia and other disorders. Unfortunately, aphasia care in our country is highly neglected, and the physicians, the neurologists are not much interested in rehabilitation of persons with aphasia. The primary responsibility for the care lies upon speech therapists or speech language pathologists. We have shortage of speech language pathologists, and they are very busy in other parts of their job, which is audiology. So audiology is concerned with the hearing assessment, and then those who have hearing problem, they are prescribed hearing aids. So the all our speech language pathologists are more busy with assessment of hearing and selling of hearing aids. The people with aphasia are relatively neglected in the care. There are few reasons. One of the reasons is lack of awareness that what type of condition it is, the lack of awareness that some treatment is available in the form of speech therapy. Another reason for the neglect is lack of interest in the neurologist and speech language pathologist. The fourth reason is lack of interest in the patient and their family. They are also not interested. They are not interested in going for speech therapy. The problem with speech therapy is that it is laborious, very time consuming, and the results are not easily seen. It requires lot of effort. Many sessions in the initial 3 months after stroke, when the aphasia is there, it should be at least 2 hours per day for 1 to 2 months. Patients are not able to afford. They are not able to go to the clinic of a speech pathologist. However, the things might improve in the near future with the help of teletherapy. You remember during the days of COVID pandemic, lot of medical care was given online in the form of telemedicine, telediagnosis, teletherapy, and we have learned how to use information technology and computers in the care of our patients, and it is equally applicable to long distance speech therapy by the teletherapy mode. Another thing which is coming to help in the form of information technology, that many applications, compute mobile applications are under preparation, and they have been made, which can be subscribed by a patient with aphasia. So they subscribe to a particular app and they can look into the app, and all the exercises which I described today and many more can be in the form of app on your mobile phone or on your iPad or tablet or on your laptop. So those things can be administered remotely by the speech therapist, and not only that, patient alone herself, with or without the help of other family member, can do all these exercises. So we have created one app called Triveni, which is a compilation of about 100 home-based exercises for people with aphasia. It will be launched soon, the Triveni app. Another app under development by me is called Shabda Chitra, in which it is a type of group therapy. Because if there is only one speech therapist and many patients, so the concept comes of group therapy. One therapist and 4, 5, 6 patients with aphasia, they can join in the same room or they can join online in a form of remote learning. So the second application which I am developing is called Shabda Chitra, in which we make the patient sit on a table or together on this in their different locations, and they are distributed picture cards. Those picture cards appear on their screen, and then there is a rotational turn taking. So one of the patient will pick up one of the cards. Suppose that card is showing the picture of a bus on the road. Now remember, he is a person with aphasia, and if you show him the picture of a bus, he is having difficulty in describing it, but somehow he's trying. And the other fellow is also having aphasia, and he is asking, do you have the picture of something which looks like, without showing the picture? And the other person, if he has the picture for which there is a 50% chance, so he will say, yes, I am having the picture, or he will say, I am not having the picture. So this type of card matching game between 4 or 6 person with aphasia goes on, and it helps in the therapy of persons with aphasia. A word about medicines. Pharmacological agents are so far have not shown any good evidence for the recovery of person with aphasia. Hopefully in the coming years more drugs will come. Hopefully in the coming years some biological treatments will come in the form of electrical current of the brain or magnetic stimulation of the brain. So those things may give you a